Hello everyone, this is a very interesting case of a patient, 1-year-old female with bilateral aniridia and bilateral congenital cataract. The IOP is 8 and 9 in both eyes. B-scan ultrasonography was normal in both eyes, so I decided to do lensectomy with IOL implantation, starting with doing the side ports, injecting trib and blue dye to stain the anterior capsule, injecting the viscoelastic and doing puncture in the anterior capsule to start doing anterior capsulorhexis. Just trying to aspirate part of the lens matter to decompress the pressure inside the bag so the capsulorhexis will not run out and extend. Now using the 23 gauge micro forceps to complete the capsulorhexis. As I already mentioned before, in such cases we always aim to push towards the center and grasp every 1 or 2 clock hours to avoid extension of the anterior capsule, and re-inject viscoelastic more frequently than in patient with adult cataract. After finishing the anterior capsulorhexis, I will start now doing the aspiration of the lens matter using the bimanual irrigation aspiration. I realized that the capsulorhexis is a bit smaller from the superior part, so I decided to do enlargement of the capsulorhexis by doing a small tangential cut using micro scissors and increasing the size of the capsulorhexis. Now implanting the IOL inside the capsular bag. Now doing the posterior capsulotomy and anterior vitrectomy. I will go behind the IOL with the cutter to do the posterior capsulotomy and anterior vitrectomy with the irrigation port above the IOL. Here I usually aim for around 4 to 5 millimeter of posterior capsular opening, so that will avoid posterior capsular phimosis and any visual axis opacities post-operatively. After finishing posterior capsulotomy and anterior vitrectomy, now I will suture the main wound and the two side ports using Vicryl 10-0 suture and injecting air bubble. And that is the end of the case. Thank you so much.